Hi, I'm Dr. James Meschino, and I want to tell you about the Nutrition Lifestyle Anti-Aging Assessment that I developed. It provides you with a customized report that outlines the best dietary modifications, supplements, exercise parameters that are best suited to your individual needs. It is the most comprehensive assessment of this type on the internet. And for many years, health practitioners that I've taught have used this assessment to help identify risk factors in patients and help guide them to the best lifestyle management program to prevent disease and help better manage many existing health problems. So over 30 years, I've taught health practitioners how to do this sort of nutrition lifestyle anti-aging assessment in their offices. But now I can do it for them using this internet technology, and now I can help you with it as well. So why did I develop it in the first place? Well, I'll tell you why. We know that in 70 to 90% of cancers, according to the National Cancer Institute, cancer occurs due to faulty dietary and lifestyle behaviors. And cancer, accounts for 30% of all deaths each year. You look at heart attack and stroke, these cardiovascular diseases, that's 40% of all deaths each year. We know that most of the risk factors are related to faulty lifestyle behaviors. High cholesterol, high blood pressure, smoking, high blood sugar, homocysteine levels, inflammation in the blood vessel wall, poor fitness level. All these things add up. And these things are all modifiable by how the person lives their life, how they eat, the activity that they do, things they're exposed to. Look at osteoporosis in women. It now affects 1 in 4 women over the age of 50, 1 in 8 men as they get older as well. Do you know that more women die, at least in Canada, every year from the consequences of osteoporotic fractures than from the combined death rate of breast and ovarian cancer? We know that osteoporosis is almost 100% preventable if people would just be taught what to do along the way. With Alzheimer's disease, only 2% of Alzheimer's disease seems to be related to genetic inheritance. The rest of it seems to be more strongly rooted in faulty dietary and lifestyle behaviors. With type 2 diabetes, 80% of people that develop adult onset diabetes, it's usually faulty dietary and lifestyle behaviors that are actually triggering the disease. That's well established. And for other conditions like arthritic changes, cataracts, and macular degeneration, which is the leading cause of blindness in people over the age of 55, as well as things like prostate enlargement. Diet and lifestyle play a huge role in the prevention and management of these problems. So the problem that I have is that when you have an annual medical exam from your medical doctor, they do a good job of the examination and identifying problems once they reach a certain threshold where it becomes really significant. But preventing the disease and using lifestyle management to better manage diseases is not really emphasized enough. Even though those are actually the most important things, how you live your life, the diet you follow, and the lifestyle patterns that you have are the most important aspect as to whether or not you're even going to get a disease and how well you can manage it if something starts to show up. So what's missing in that medical consultation is an in-depth analysis of your nutritional behaviors and dietary patterns. I mean, are you on track or are you off track? Are you eating in a way that's moving you towards risk of heart attack and stroke and cancer or osteoporosis or Alzheimer's disease or diabetes? And what about dietary supplements? 7 out of 10 people take supplements today. Why? Because they do something. That hardly even gets mentioned. The right supplementation program can actually counter many things in the body's aging clock to keep you more functional as you get older. Certain supplements have been shown to help combat existing or recurring health problems that people have. Certain supplements can reduce the likelihood you might even develop a disease down the road. At the same time, when people self-medicate with supplements and they don't know what they're doing, they can cause a dangerous drug-nutrient interaction to occur. So you have to also make sure the person's not taking the wrong supplements. And you also need a customized exercise program, at least the parameters, what your heart rate should be and some other factors should be included. So in the Meschino Health Assessment that I've developed, this online nutrition lifestyle anti-aging assessment, it provides you with a customized report that outlines the nutrition, exercise, and supplementation plan that's best suited to your individual circumstances. So how do I do that? Well, the assessment factors in a lot of things. Your age, your gender. It looks for signs of nutrient deficiencies that you may already be having. It looks at medications you're taking and other factors that may be depleting nutrients from your body. It looks at some body shape measurements. It looks at your activity level. It looks at recurring health problems that you have and current health problems that you might be having. That over and above medication, some dietary and lifestyle advice may actually help to improve the outcomes. It also looks at things that run in your family that you may be predisposed to. How do you build up your resistance to those diseases that may run in your family? Has anyone ever explained that to you? And it looks at the medications that you're taking to make sure that you don't get inappropriate advice that would actually be dangerous. And it looks at other health conditions that you have where certain dietary things or supplement things might actually be not in your best interest. It even includes how many grams of protein you should have each day. Where should you get those grams of protein? What your heart rate should be when you're exercising to burn fat and for the best cardiovascular benefit. And it shows you the exact dosages and even the standardized grades of certain herbs in terms of supplementation that best suits your specific needs so that you don't waste your money taking supplements that are actually a waste of time if you aren't going to do anything meaningful or may actually be harmful. I will tell you that every single adult should take this online nutrition lifestyle anti-aging assessment. And take the feedback from the report very seriously, because the foods that you eat, the supplements that you take, the exercise that you do, the carcinogens that you expose yourself to, these are the most critical factors that are going to determine how long you can expect to have a highly functioning body and mind, and how long you're going to remain free from terminal diseases or advancing illnesses. So we've never known in the history of man more about how to develop or achieve optimal health and longevity. And yet most people unknowingly sabotage themselves through faulty dietary and lifestyle practices that lead to premature illness and premature death unnecessarily. So the online nutrition lifestyle anti-aging assessment, it'll get you back on track, give you a customized program that's suited to your specific needs and circumstances. So I would encourage you strongly to take the assessment today and pay heed to the evidence-based program contained in your feedback form. And I just want to wish you luck with your wellness goals. I will encourage you to stay the course. I will tell you it's worth it. Thanks so much for watching.